Hello, today we're going to look at Chapter 23, which is Diseases of the Musculoskeletal System and Connective Tissue, and this corresponds to Chapter 13 in the ICD-10-CM Codebook. This chapter has a lot of medical terms and anatomy that you're going to be lost if you can't remember your anatomy of a musculoskeletal system. So having said that, if you still have your medical terminology textbook that is based on medical body systems, I suggest pulling it out and looking at bones, joints, connective tissue, just to kind of familiarize yourself with this body system. The medical terms here, I'm not going to read them to you. As you know, these PowerPoints are available for you to review, both for studying for the exams as well as just for your personal knowledge. Coders are excellent at anatomy and physiology. They understand body systems. They understand the physiology of how the body works to maintain homeostasis. Remember that word, which is a stableness. For the body to maintain the same stability of its systems, a lot of things have to work in concert with one another, and that's why it's important to understand all the body systems and how they work together. The next slide talks about coding acute traumatic conditions versus chronic or recurrent conditions. Chapter 13 in the code book contains the bone, joint, and muscle systems that are the result of healed injuries as well as recurrent conditions. Current traumatic or acute injuries are coded in Chapter 19. So that is important when you're reading the diagnostic statement. You're going to look for terms like old injury or current injury, because that is going to really help you know which chapter in the ICD-10 codebook you're going to be looking at. If you cannot tell from your documentation if it's an old or a new injury, that's when you're going to have to do a query and just ask the provider which it is. Back disorders or spinal disorders are also included in this chapter. It is important to understand degeneration of the disc is not the same as herniation or displacement of the disc. Degeneration is something that we all have, that loss of cushioning between our vertebrae, many times related to aging, although it can be an injury that causes that cushioning to be decreased. When I was working in the hospital, I had a patient who a truck fell on him, and when it fell, it crushed his vertebrae by just compressing them, causing that cushioning to just shoot out. So it was, his was more, I guess, of a herniation, now that I think about it, because it actually pushed the center part of his vertebrae down and completely severed his spinal cord. So he left the hospital as a paraplegic, but thankful to be alive. In his case, he was a young man. I have this picture here of a herniated disc, a condition in which that tough outer wall of the disc has been weakened, and that allows the softer insides to deform the shape. And that often compresses on those nerves, and that's what's causing some pain. The picture here shows a gentleman lifting a heavy rock. Really, many times, anyone who is in heavy lifting as part of their jobs will herniate their disc. The types of fractures that you're going to be looking at are stress, pathological, and traumatic. And depending on the type of fracture it is, you have different options for your seventh character. So let me just show you one. I think I have it here. No, I don't. This particular condition is collapsed vertebra. And you see the pink box is more than just the ones we've seen in the past, where we saw the initial, the subsequent, and the sequela. In this case, this particular code, you have the initial encounter, the subsequent with a routine healing, and the subsequent with a delayed healing. So a different option there, and then the sequela. Here's another one. This is osteoporosis with a current fracture, a current pathological fracture. And these are your options for your seventh character, many more than we've had in the past. We have the subsequent encounter with a routine healing, subsequent encounter with delayed healing, subsequent encounter with non-union, meaning it won't heal at all, and subsequent encounter for malunion, meaning it's not healed the way it's supposed to. And then, of course, the sequela. So depending on the code, you're going to have different options for your seventh character. Okay, here's some more medical terms related to fractures. You've got displaced, where the bone is actually snapped in two and now the two ends are not lined up anymore. Comminuted is a very common displaced fracture. The non-displaced is when the bone is cracked but it hasn't moved, so it's still in its proper alignment, but it's cracked or part of the way or all the way through. An open fracture, the bone has actually come through the skin, and closed, the bone can break, but there's no puncture or open wound in the skin. Sometimes with the open fractures also, the bone pierces the skin, but then it goes back in from the injury itself. There's a force that causes it to come through the skin, and then a reciprocal movement in the other direction that causes the bone to go back through the skin. So it's just a very traumatic injury that often predisposes a patient to infections. Some fracture types you may remember from your medical terminology course: the green stick, very common in children, transverse, oblique, comminuted, and the buckled. And the buckled is what you often see in the arm fractures in children. So just if you still have your medical terminology textbooks, and if not, you can certainly Google these online and look at these types of fractures and what they look like. It might be very helpful to you to help you remember them if you have a visual. I just went over some of these in the picture that we showed for pathological fractures, so I won't review them now. But just remember, you can always print out these PowerPoints if you want to have them for reference in the future or to study for exams. That's why they're there, so feel free to print them out and put them in a notebook or whatever you're using. A couple of notes you're going to always remember as a coder, and these are at the beginning of the chapter 13. But just to review, a fracture not indicated as displaced or non-displaced is coded as displaced. So that's an important thing to remember. The open fracture designations are based on the Gustilo, which we will go over in a few minutes. And a fracture not indicated as open or closed is coded as closed. So those are important generalities that when you're coding, that's just the assumption you make. You're going to follow the rules, and these are the rules. I went through a few of these. I created the PowerPoint obviously before I recorded this, so I've already gone through some of these additional seventh characters. I'm not going to go through those again, but I did want you to see that some of the fractures, like S72, actually have 16 options, including whether the fracture is open or closed. So you really have to read all of those seventh character descriptions before you select your final code. The Gustilo open fracture classification we're going to look at on the next slide. It actually uses the amount of energy that caused that break, the extent of the soft tissue injury that accompanies that break, and how much it is contaminated because of coming through the skin. Anytime you have a progression from grade 1 to grade 3C in your classification, it implies a higher degree of energy is involved in the injury. Therefore, you've got more soft tissue and bone damage and a much higher potential for complications. And recognize that the grade 3C, which is your highest classification fracture, implies vascular or blood vessel injury as well. Very serious injuries. And here is the Gustilo. Again, I mentioned a few slides ago, print these out, put them in your notebook so that you have something to refer to. This is not, I didn't find it in the code book. I found this online by Googling Gustilo open fracture classification. But it may be in the code book and I just missed it. So if you find it, let me know, and I'll put references there for future classes. Also remember that pathological fractures can be due to cancers, to neoplasms. If the focus of treatment is the fracture, then you're going to use a fracture code, and in this case, it is M84.5, fracture due to neoplasm, followed by the code for the neoplasm. But if your focus of treatment is the malignancy itself with an associated fracture, you're going to code the cancer diagnosis first and then the M84.5 as the secondary diagnosis. This is a coding guideline that often comes up when you're coding malignancies because of how common it is for the patient to have breaks or fractures because of bones weakening, typically due to bone cancer. A few more rules about coding. Fractures that are spontaneous, where the physician has documented spontaneous fracture L2, you know that those are pathological fractures. And you should never code a traumatic fracture and a pathological fracture on the same bone. It's either one or the other. And if the documentation isn't clear, it is appropriate to query the provider to find out if you are dealing with a traumatic fracture or a pathological fracture. Okay, a lot of review there, but it's important in this chapter especially to go over those things.